All right, thank you very much once again for being part of this webinar. My name is Akola Jimo. I work with Sydani and I'll be the moderator of today's webinar. Of course, the topic is improvements in the Nigeria public health disease surveillance and response since the outbreak of COVID-19. And there's a big question of, are we retaining the gains and moving forward or falling back? This is what we'll be discussing today, where we have highly seasoned professionals who will be dissecting issues as regards to public health disease surveillance and response as it relates to COVID, the outbreak of COVID-19. But before we start, we would like to have an opening remark from the managing partner of Sydani Group, in person of Mr. Sidney Sampson. Just to also mention that this webinar is one of the activities earmarked for the 5th anniversary of Sydani Group. So without further ado, I'll hand over the stage to Mr. Sidney Sampson, who will be providing the opening remark for this session. Mr. Sidney Sampson, sir, please, over to you.
Good morning, everyone. Good morning, respected directors from our esteemed government agencies, our well-respected donor and partner organization representatives, our colleagues, associates, and friends. I'd like to warmly welcome you this morning to this groundbreaking webinar where we discuss really insightful elements of our progress as a nation. And for me, as Makolade had mentioned, this is a very exciting moment where I am proud and humbled to be having this wonderful meeting with all of us, and where we cross-examine some of the lessons we have learned as a nation, as a people, from the pandemic that brought the world to its knees, and actually looking at things and saying, what are we taking from all of those learnings that we had? We know that with the COVID-19 pandemic, a lot of things happened. And one of them, which I'll really be looking to learn a lot more about, is the improvement in surveillance that happened at neck-breaking speed, with the NCDC leading that. We know that I've heard those stories of having really few public health EOCs, and then they had to scale literally overnight from a few states to having those EOCs across all of the states in Nigeria. Support from everyone to make sure that happened. Having huge for health workers across the country, things that we've never heard of before. Having virtual trainings that were the hallmarks of some of the learnings. And of course, having a lot of, again, sacrifices from health workers who were at the front of all of the fights that Nigeria and the whole world fought to get back the lives that we have today, to be able to walk around without face masks and all of that. So for me, this is a really interesting conversation, and I want to really welcome everyone and wish us wonderful deliberations as we go. But I won't finish without saying that, as the moderator mentioned, this is one of many events that we are using as an organization as we mark our 50th anniversary in August of this year. And would like to use this as one of the first public engagements we're having to express our profound appreciation to all our partners, to all our friends, to all our donors, to the government and the non-government alike, for the work we've done together, for the impact we've been able to make together within the Nigerian ecosystem to deliver impact. We couldn't have done it without all of you. And I really want to say a big thank you to one for that as we march on as partners to continue to do wonderful things to improve our country, our economy, improve Africa as a whole. A brief history. So Sydani actually started in 2018, around August, and there was just myself and another colleague. His name was Awal, and we didn't even have an office at the time. And between then and now, we've moved offices uh, 4 times to the current place where we are. We've grown from that 2-man team to over 100 staff with work, in Nigeria, across, many states, all the states, and, other African countries. And like I said, that has been possible because of the partnership that we have enjoyed with everyone here today. And as we mark the 5th anniversary that is themed Unveiling the Future, we hope that with these insightful conversations that we would have, it would also help advance the public health space, the other areas of Sydani's focus, and also position us in our partnership to continue to provide more impact, working with every single one of you. So again, I want to especially welcome you and thank you for making out time out of your busy schedules to join this webinar. Please, I'll be listening attentively, so I also hope you're able to do the same, as we have a strong lineup of panelists with deep experience in surveillance and COVID-19 work, and all who would be, telling us how we are doing as a nation and what the future holds in terms of how we retain all of the lessons that we learned, all of the gains that we made, how we are retaining them and ensuring that they are not getting eroded with time as we continue to strengthen our systems for better health delivery and general well-being in our country. Again, thank you, everyone, and have a pleasant engagement. I'll be listening attentively. So looking forward to the very wonderful discussion that will be taking place. Thank you.
Thank you very much, Mr. Sidney Sampson. Thank you. That was really, really great. And of course, while giving your opening remark, there were some very fundamental words you said, which is touching on the job partnership. And of course, there's no gainsaying that the response to COVID-19 in the country can be greatly attributed to the wonderful partnership by partners and government. NCDC was really instrumental in terms of keeping us updated, providing guidance, and of course, when the issue of vaccination came in, and there was need to get people vaccinated, MPACDA, as always, was really instrumental in ensuring that a very high number of people were vaccinated, deploying different strategies. And of course, Sydani Group, being one of the partners that's been able to contribute to this, what better way to celebrate the 50th anniversary of Sydani than to have some sort of reflection, going by the way of, reviewing the learnings and also, identifying the gains from all of the strategic interventions that have been deployed. So thank you very much, and that's a very good way to set the tone for the conversation. So moving forward, I will be running us through the objectives of today's webinar so that we are all on the same page, and we'll move along in that line. The first of it, of course, is to discuss the strength and weakness of the disease surveillance in the country. And the second one will be for us to then understand the lessons learned from the COVID-19 pandemic as it relates to strengthening the Nigeria's public health surveillance and response system. So we'll be looking at this. And of course, as I mentioned, we are so grateful and we're so lucky to have the wonderful panelists who will be dissecting issues, who will be also sharing their insights and thoughts as regards this. But before we go ahead, it is very fundamental for us to even get to know our panelists. So with that, I'll be giving a very brief introduction of the panelists for today's webinar. Yeah, so I will have it. I believe we can all see my screen. We have Mr. Sunday Atobatele. Mr. Sunday Atobatele is a principal here at Sydani Group. And next to him is we have Dr. Oyeladu Okun Romade. She's the Director of Surveillance and Epidemiology at the NCDC. And we have Mr. Evans Ondura, the Deputy Country Director of Palladium, Data 5, and Dr. Basi, who is represented by Dr. Adijoke. Dr. Basi is not able to join us today because of other issue of top priority that he needs to attend to. And we have Dr. Abbott Samuel, who is an epidemiologist and head of surveillance at Hafenet. And of course, I am Akolade Jimo, and I will be your host for today. So thank you very much for being part of this. Very quickly, I will run us through the profile of our panelists. So Mr. Sunday is a principal, as I mentioned, and the director of Sydani Fellowship Program. Is a senior management consultant and is a public health professional. He leads Sydani work across data analytics, financing, vaccine logistics, and supply chain management. And Mr. Sunday has led the development of a financial model and 5-year national investment strategy for transitioning polio investment to the government of Nigeria, and also worked as part of a consortium to develop and cost a 5-year strategy for sustaining and institutionalizing social investment in Nigeria for the office of the Vice President of Nigeria. Prior to joining Sydani, he has led Solina's effort in revitalizing Nigeria's vaccine supply chain systems to improve routine immunization coverage and reduce the burden of vaccine preventable morbidity and mortality on the fives. Mr. Sunday has a postgraduate training in public health from Johns Hopkins University, Maryland, in the United States of America, and executive leadership training in immunization and vaccine supply chain system from the World Health Organization. He is an alumnus of the Federal University of Technology, Akure, where he obtained a first-class degree in Bachelor of Technology on honors degree in food science and technology. So, distinguished ladies and gentlemen, on the call, we have Mr. Sunday Atobatele. You can see that This is the right peg in the right hole today. So thank you very much, Mr. Sunday Atobatele, for joining us. Moving on to Dr. Oyeladun Okunromade. She's an accomplished senior public health and global health consultant with over 18 years extensive experience in managing public health programs, in development of public health strategies, and strengthening health system. She is the director in Nigeria Center for Disease Control, NCDC, with multifaceted practical experience in international health regulations, implementation of national action plan for health security, One Health surveillance and epidemiology of infectious disease, multi-sectoral coordination, data collection analysis, and program management. She has also led efforts in development of surveillance strategies, clinical trials phases, and the development of national policies and guidelines and reviews. She's also very versed in grant writing, implementation of projects and grants, monitoring and evaluation of grants and projects at national, regional, and international level. She has also contributed to efforts in healthcare development and country profile development. She is a public health physician by profession and associate or fellow of National Postgraduate Medical College of Nigeria. She's a fellow of International Program in Public Health Leadership from University of Washington, and a fellow of One Health Institute of University of California, and a graduate of Nigeria Field Epidemiology and Laboratory Training Program. Wow, I am fascinated. I hope you are too. So moving on to Mr. Evans Ondura. Mr. Evans Ondura is a certified project management professional with extensive experience in data analytics, data demand and information use, project management, data visualization, health informatics, digital health, informatics governance, management information systems, performance measurement, monitoring, evaluation. Is highly involved in health system strengthening by improving health information system, business processes, and data analytics in the health sector, and currently is the technical lead for the informatics, data use, and analytics portfolio with key emphasis on implementation of robust analytics and health informatics strategies to leverage global good solutions to achieve epidemic control. He's currently the country director, technical lead for health informatics and data analytics and data use portfolios, with a crucial emphasis on the implementation of robust analytics and health informatics strategies to leverage global goods in solution in the digital health space to accelerate tracking of health indicators and interventions for HIV epidemic control, emerging COVID-19 pandemic, and other existing disease areas. Yes, so Mr. Evans, please get ready for me. I've been asking a lot of questions that's around the use of technology and data as regards to public health concerns. Yes, and we have Dr. Abbott. Dr. Abbott Samuel is an epidemiologist and surveillance lead of National Stop Transmission of Polio Program, NSTOP, as the African Field Epidemiology Network, AFRINET Nigeria, is a member of the National Surveillance Working Group and National Coordination Committee for Adverse Events following immunization. He has worked as team lead of the Stop program in Jigawa, Kaduna State, providing technical support for coordination, planning, implementation, monitoring, and evaluation of the polio eradication initiative and other public health interventions. He's deeply involved and has experience in immunization, surveillance of vaccine preventable diseases, and other diseases of public health importance. Epidemiological research, program management, national surveillance, guidelines reviews, development, monitoring and evaluation of projects at national and international level is part of his competence. He also has extensive experience in surveillance for adverse events following immunization and adverse events of special interest, and he has been involved in the rollout of safety monitoring surveillance for novel oral polio vaccines type 2 and COVID-19 vaccine, collection, review, and casualty assessment of safety data for the novel oral polio vaccine and COVID-19 vaccine in the country. Again, I am wowed. Yeah, so we have Dr. Adejoke joining us too. Of course, Dr. Adejoke will be standing in for Dr. Basi, who is unavoidably absent. So, but I mean, speaking to what she's doing, Dr. Adejoke is the Grand Commander, that's what we call her, of the COVID-19 war room, and she has been really instrumental leading this. Of course, she's the representative of the part of the government here. And if there's any profile, if there's anything I've mentioned as regards what everybody has done here, trust me, she has done this and above in terms of what the accomplishments have been. So distinguished ladies and gentlemen, thank you. And these are the panelists for today that will be sharing insights, dissecting issues, and giving reflections as regards the topic for today. Without wasting time, and quite frankly, I can't wait to just jump into the conversation, knowing that we have people who are well seasoned and experienced to help us reflect and gain some insights as regards the discourse for today. But my first question for today will be directed to Dr. Adejoke, right? And I would like to ask Dr. Adejoke, as far as the COVID-19 response and the surveillance is concerned, right? In what ways do you think the Nigerian public health system has improved its disease surveillance and response capability since the outbreak of COVID? There has been several strategies that have been deployed to respond to COVID-19. And of course, the National Primary Care Development Agency has really been very instrumental in doing that. So it would be good to hear from you, Ma, what has improved in terms of disease surveillance and also the response capability of the country as far as COVID-19 is concerned. Please, if you don't mind, our panelists kindly turn on the video so that the audience can see you. Over to you, Dr. Adejoke. Hi, Dr. Jule, please, can you confirm you can hear me, please? Hi, Dr. Jule, if you're speaking, you're mute. Okay, so while we wait for Dr. Dijoke, um, Dr. Oyeladan, I'd like to, okay, yeah, you
Sorry,
have an.
the network kicked me out. Sorry.
Okay.
Sorry. So could you please help me reiterate? I couldn't get some part of it. Yeah.
Okay, so my question was, for the National Primary Care Development Agency, which is the agency responsible for, vaccination of people for COVID-19. I would like to ask that in what way do you think the Nigeria public health system has improved in its disease surveillance and response? Since the outbreak of COVID, I know a lot of strategies have been deployed. There has been a lot of initiatives. So in what way has the public health system, how has it improved? How do you think it has fared? Are we doing better or are we going backward?
Okay. Thank you very much for that. Actually learned a lot for this and the primary healthcare system also, because the immunization program is just an offshoot of the primary healthcare system. And one of the first things that we had to rally around at the beginning of the pandemic was to prepare preparedness plan, a response plan for the primary healthcare system. How to put systems in place.
Hi, Dr. Jujoke. Okay. I think Dr. Jujoke is having some network issues. Yeah. Okay. So very quickly, while we wait for Dr. Dijoke to just get a connection back, I would like to, ask you this question, maybe very quickly, Dr. Ilado. Dr. Ilado, please, can you confirm you can hear me?
Yes, sure. Can you hear me?
Very well, loud and clear.
Oh, okay. Thank you very much for inviting me. And as you all know, before COVID-19, this surveillance, when it comes to surveillance, is a core major mandate in Nigeria. We work closely with all the state EPID at the state level, as well as the LGA GSN, to ensure that we have a robust data in the country. Specifically, when COVID-19 came, it brought up upon a lot of improvement on our surveillance, disease surveillance, and response capacities in the country. And I would give specific examples. One of it is we have now been able to train a number of surveillance officers at the subnational level, using a frontline field epidemiology repackaged, I'll call it a repackaged program, because we look at the different silos surveillance training programs, harmonize them together into a well-robust training curriculum, and then we now start rolling it out across all the states as well as the LGA. And we rolled it out to at least 23 states in the country, and currently it's still ongoing. It's an offshoot of the field epidemiology and laboratory training program, but this time around the front line for the surveillance officers at the front line, at the community, as well as at the national level. And these has actually improved and provided high quality surveillance data, not only for COVID. It actually improved surveillance quality data for COVID, and during COVID, we were able to report our cases daily. Every night, you see publishing COVID cases on all our social media. But aside COVID-19, we've also been able to leverage this on all the reportable, notifiable diseases as well. Also, as part of the capacity building at the state level, states were expected at the peak of the COVID to produce daily situation reports and ensure that they give an update to national every day on the situation of COVID response at the state level. Following COVID-19, this daily this CTREP has now metamorphosed to sharing what we call the regular surveillance bulletin. So states are now being empowered to share, to produce bulletins of what is happening at the state level around the surveillance activities, priority diseases, and they use this medium to notify national as well as notify all the stakeholders for evidence-based decision. Also, we have an electronic IDSR surveillance platform known as SOMAS for the country, which we rapidly rolled out during COVID-19 for a real-time collection of data for surveillance data. And currently, that is what Nigeria is currently using now, leveraging on the gain of COVID-19. So there's so many specific ways. Then talk about the event-based surveillance platform. Also, this we is a form of an unstructured surveillance data, picking conversations from different social media, from news outlets, other channels for rapid verification and response. This is a form of a rumor management system, and for information sharing with risk communication team for their infodemic management system. Also during COVID-19, we rolled out a short code known as 6232 for people to reach out with verified information on COVID-19 and other infectious diseases, which we usually escalate either to the state or to the nearest EOC for further verification as well. And this call center now is not just at the national. We've also been able to replicate this call center at the state level, known as the state hotline for their public health emergency operations. So these are a few of the specific ways in which there's been a lot of improvement in disease surveillance and response capacity since the outbreak of COVID-19. Thank you.
Well, thank you very much, Dr. Iladun. That is quite insightful. A lot of things that you said there. You know, part of the things I was able to pick out is you had mentioned the part of the training of these surveillance officers. And of course, we all know that capacity building is really fundamental. People cannot give what they do not have. You've also mentioned that as a result of this, there has been high quality surveillance. There's improvements in reporting. There has been regular surveillance system. I love the part of the electronic system that you mentioned, the summons, and of course the rumor management and all of that. This is highly unprecedented, right? And it's quite interesting to hear this. So I would like Mr. Evans to lend his voice to this. I mean, looking at his profile, he has done lots of things, the data management and also use of technology. So, Mr. Evans, to you, how do you think things has improved? Coming from a partner who has also worked with government to contribute to many of these successes. What do you think in terms of the improvement that has happened in terms of our disease surveillance and response capability as a country? Yeah, over to you, Mr. Evans.
Thank you, Akolade, and just to pick up from the same breath of the good doctor who's really articulated most of the improvements that so far as Nigeria has taken lead in improving its surveillance systems. So I think most of it in terms of she's dead on and spot on. A lot of efforts, if you're looking at maturity of systems to support response to either threats or emerging diseases, you'll find that the systems, I think the government put a lot of system in a short time really to respond to this COVID-19, especially this outbreak. So one of the key areas that I think they also improved on, if you look at even improved as talking about real-time monitoring of data, there's a lot of systems at play. Very many different systems were trying to put an influx of data from everywhere. And I think NCDC and also, let's just say in part the other government agencies were able to narrow down and really have a singular source of information in terms of the cases that were emanating from COVID-19 in response. So in respect, there was a lot of some aspect of governance that was put in place to just control a lot of data information and flow across the different hierarchies from both subnational level up to the national levels. So also to look at that, she's mentioned around systems around communication. I think there's a lot of use of social media and other. So there's a lot of web scrapping in terms of use a lot of this information that was coming from these communication platforms, which also played a huge role in terms of really eliminating some of the rumors that were coming across different just a lot of that contributed to a lot of theories and mysteries around COVID-19. So I think the government really played a very key role to make sure that there's a lot of information overflow to the public, the right information, if I have to put it to that extent. But we can also don't really underplay the role they really played in terms of having a robust capacity building strategy around this, and they utilize a lot of technology. Remember, a lot of restrictive movement, so they really put a lot of systems in place to really train their capacity of their workers to respond in this high voltage environment that was in at this period. So, and also I think, as mentioned, the good doctor, I think the most amazing thing they did was increasing the testing capacity. So I think as much as you look at it, it takes a lot of nuts and bolts to move a lot of that process, so just to carry the load that was requested for, to have a lot of testing points both at the border, the facilities, and everywhere else. So they really put a lot of those systems in place, and just to make sure that there was a rapid response in this emergency area. Yeah. So a lot of documents, NCDC played a key role. Also, just to, as mentioned, there was a lot of the setups around the EOCs. I think they provided enough guidelines to manage these particular setups, which was really easy for even partners who are coming into support to really respond based on those guidelines, to really integrate and also make sure that their response from the donor funding aspect, they were able to integrate to the national guidelines that were already put in place. So a lot of movements are put in a very restricted, confined timeline, and I think it was really impressive that the system was really ready to respond to that. I think on that continuum from the surveillance, there was also some efforts around the vaccine acceleration piece, which also fed into having a lot of their systems in place to respond to tracking of vaccine logistics and distribution at the different areas. I think there was some bit of employment of some modeling aspects to just make sure that there are essential supplies, and WHO provided some so a predictive tool to actually look at the supplies that are required to respond to either both the testing and also the vaccine aspect of it. So there's a lot of systems in place both for reporting the surveillance and also the vaccine acceleration. So as I mentioned, I think there are still areas to improve, but I think given the high voltage of the scenario that was there, I think agencies really came together to respond at that level and improve their system, both information system and also just basically the physical infrastructure, the logistic infrastructure that are played just to have a full continuum of services provided to the general population. So I'll just put it at that. Yeah. Back to you.
Yeah. So thank you very much, Mr. Evans. Thank you very much. Yeah, very critical point you've mentioned as well, incorporating what Dr. Elan has mentioned. And part of the things you mentioned was also to mention the part of governance and also communication, documentation, and development guideline, and I also picked that part of vaccine acceleration. Yes, I think that's very correct. And the use of social media, I remember that time, the information was everywhere, the type of vaccines to take, where to go for testing, what to do, what not to do, all the guidelines about how to wash hands, that part, those days when there was very clear instructions to every setup. People, you should have one like what spacing in between and all of that. So yes, I totally agree with you. So thank you very much. Yes. So Dr. Okay, back to you now for my next question. Right. Okay. Are you with me now? I want to be sure you can hear me.
Yeah. Hopefully it doesn't go off again when we start talking.
Okay. Hopefully. Yes. So with all of this wonderful work that Dr. Elad has mentioned, corroborated by Mr. Evans, what has so in terms of the lessons we've learned, right? Has there been a way that we've been able to apply those lessons to strengthen the public health system in the country, the public health infrastructure? So there has been a lot of learnings around data management. There has been lots of learnings about reporting, documentation, contact tracing, like a whole lot. How are we able to put together those lessons learned to really strengthen our public health system? I mean, so that years to come, we don't know what might happen. How are we not going to, ensure that we are not reinventing the wheel, but we're able to build upon all of these learnings? So how are we able to put all of these learnings to use, right? So I would like to get your perspective about that.
Okay, thank you very much once again. So I think one of the learnings that we from at least from the PHC aspect, primary healthcare aspect, was the use of EMID, and the EMID is the electronic management of immunization data. So let me go in form of data and electronic in that route. So what we so COVID-19 helped us to be able to develop that system of reporting for those who have taken vaccinations, and I think was one of those things that Nigeria led on globally, have that reporting system, that electronic reporting system, so that anywhere you are, they can, once they scan your card, they can get your details and how which of the vaccines you've taken, and it also helped to ease movement of people across, because anywhere you can get your data. And it's already been translated into the routine immunization system and other PHC services. So we're using that system to be able to move it into immunization so that we don't have to now be physically carrying, even if you do carry physical cards around, you have your QR codes and all that we can apply to the routine immunization and to other PHC services so that you know what has been taken and what has not been taken, and it helps generally health security across the world, and for Nigerians in particular. And I think also one of those things we learned was one of those things that the COVID-19 pandemic helped us do was to expand our cold chain capacity. So we're able to expand our cold chain capacity, get new equipment to expand our cold chain volume to be able to accommodate more vaccines. And then through our partners, we're able to also get new ways to distribute vaccines right down to the health facility. So one of those things that we learned from COVID-19 is how to integrate our resources and also our plans, and to be able to reach the lowest level, at least mostly at the community, with vaccines and other communities. Well, at the end of the day, we came up with, we adopted an integrated system, which was the one plan, one country, one team, one management. And so that's how we moved to integrate all our resources. So we're delivering healthcare services as a package, even with the COVID-19 vaccines. It was not just parallel programs running, and this also helps us to save cost at the end of the day as we move. So those were some of the main things that we were able to translate, and we are still using, even as, and strengthening the system as we're going. So we have integrated our services, we move as one, and then we've improved the EMIT system, electronic management of immunization data system, to be able to help us get information right down to the lowest level. And then we have also improved our partnerships across board. So not just our traditional partners that we used to work with, but also other partners have come into the immunization space, primary healthcare space, and we're able to use those methods to be able to get services to the lowest level. And we've also been able to improve our community structure. So we had this social listening and community polling programs that were going on through the process when immunization started. And then we use that to get feedback from those lower levels, what their challenges are, what how they are not receiving vaccines, and then apply that to the immunization program to be able to reach them with the vaccines. I think let me stop here for now. Thank you.
Yes, Dr. because I know if we allow you, you probably will tutor us about all of these things. I mean, which is quite what we want. So thank you very much. So I've heard a lot of things. One of it is the use of the EMIT system, which you explain as electronic management of immunization data. And now there's the use of this. This was used for COVID. Now there's a plan to have it for routine immunization in a more sustainable way. And of course, expansion of the cold chain capacity, integrated services, and more. That is really wonderful, right? And this a story of how we're able to apply all of the learnings in improving or strengthening the public health system. So, Mr. Sunday, like now to you. Sydani as a partner that has been really involved and has contributed a lot to all of the gains that we've had from the strategies for COVID, right? What do you think? How are the partners able to also use all of this learning? What has there been a way that we are guiding the support to government, or we are approaching approaching the word. We are approaching support to government. Bearing in mind that our learnings, we don't have to reinvent the wheel. So I'd like to get a perspective about this, Mr. Sunday.
Thank you very much. And I mean, for all the panelists that have spoken, they've spoken really about the whole of system approach that the government has used in terms of responding to the COVID-19 pandemic, and of course, in terms of the disease surveillance. So really what we did was more of to build on existing systems, walk through the existing government system. So if you look at, for instance, in terms of tracking of the AEFI, that's the adverse events following immunization that came from the COVID-19 vaccination. So we worked with the NPAC and NAFDAC to sort of digitize the reporting process. So strengthening the whole system of reporting so that data can be gotten in real time and used to inform actual response. So if it's going to be the minor major EFI, so we supported in training of over 10,000 healthcare workers across the entire country, of course, responding from BMGF. So just make sure that healthcare workers have the capacity and the tool to report AEFI, especially as they're being tracked right on the field. Another thing that we also supported in terms of just direct responses in terms of COVID-19 vaccination. So a national, working very closely with the NPAC, designing, of course, the models for distribution and the strategy for the COVID-19 vaccination, working with the COVID-19 strategy group at the national level. But at the sub-national level, beyond just developing strategies, we are also able to work with the state government, the state ministry of health and the state primary healthcare board to sort of just roll out the strategies that have been developed at the national level, contextualize them to the states based on state-specific factors and sort of help them to drive the uptake of the COVID-19 vaccination. But interestingly, what even informed some of the strategies was that once the COVID-19 vaccine came in, the expectation was that there would be a lot of uptake, given that everybody knows about the COVID-19 pandemic and people typically just want to get protected from it. But it was a bit different when even the healthcare workers were sort of hesitant to taking the vaccines. So we sort of did a little study to understand the drivers of the vaccine hesitancy and what are the strategies that can be adapted in terms of improving the uptake. And the findings, of course, informed a number of the initiatives that are rolled out in the states, not just using the fixed approach, using the mobile to get to the vaccines to the people. Also, we identified that social media was a major source of information for people about if they will get vaccinated or not, where to get vaccinated. So, of course, we're learning from the NCDC, who have already instituted a means of getting information from social media. We also had a social listening tool that sort of just gleaned information from the general public regarding their leanings towards the COVID-19 vaccine. So if they would take it, why would they take it? If they wouldn't take it, why would they not take it? That also helped to sort of track major misinformation about the COVID-19 vaccine on social media. And NPCDA was always very prompt to respond to that. But that didn't even moved beyond just being responsive to being proactive. So when you have a lot of information, you can decide on what kind of message to put out. And so NPCDA, and after that, they had these FAQs, so the frequently asked questions about COVID-19 vaccines, who should take it, who shouldn't take it, who is it safe for, and all of that. So we're also supporting that process. I think across the board, the government already had the system in place, which then made it very easy for partners to come on board and then take different aspects of the work that are going and then support that either through capacity building, technical support at national and state level, or even engagement of vaccination teams to go out and distribute the vaccines, a daily tracking of the data, both from the AEFI reporting and then the COVID-19 vaccination to know who is reporting, who is not reporting, who is getting vaccinated. And even if there are stock out for vaccines, it goes as details as knowing locations where there are stockouts and then working with the states to deploy the vaccines to those areas. So really all we did was build on existing systems that the government has set up and then brought in modified approaches to just make sure that things are fast tracked and results are achieved. Thank you.
Thank you very much. That's quite hard. Thank you, Mr. Sunday. A lot of things you said there. And one thing that jumped out for me, I like the word you used, proactive instead of responsive. That's really wonderful. So it tells the story of how we are able to even, not just sit there and wait for things to happen, but we're thinking ahead of what needs to happen before it happens. And I love the part of what you said around the study that was conducted. I mean, this is really fundamental so that it also doesn't come from the point of just having strategies deployed, but to knowing what people need. What are the barriers? What are the enablers of vaccine uptake? And Sydani being positioned as an organization that is leading such initiatives. So thank you very much, Mr. Sunday. Now I'll ask very quickly, Dr. Samuel, right? So with all of these wonderful things you've said, all of the gains, all of the learnings, what do you think are the challenges that will be encountered in retaining the gains in disease surveillance and response since the outbreak of the COVID-19, since the outbreak of COVID-19, and how have we been able to mitigate these challenges? Of course, there's nothing good that will not have its own challenges. Things cannot just be perfect, right? So it's for us to understand what are those challenges and how we're able to mitigate those challenges.
Yeah. So thank you for the questions, and are excited about all of the things the other panelists have mentioned so far. I mean, it shows how resilient we are as a people, and as also a nation in responding to emergencies, just like what has happened. A lot of things were done, a lot of things were put in place, capacities were built, and we really made progress as far as public health surveillance is concerned in Nigeria, and that was occasioned by the pandemic. So the pandemic largely basically further exposed the weakness in our health system. But I think government and partners that were involved were really able to like walk around and to put all of the structures that we are in place that was used to put the pandemic under control across the country. So again, we have made significant gains and progress, but like with other responses, and I think this is characteristic of our country, we have emergencies, we come deal with them, and then everybody forgets about what has been done. So there are usually not efforts to sustain those structures and investment that have been made to respond to such emergencies. So basically, sometimes you see what happens is we have shift in priorities. Once the immediate crisis is over, the priority tends to change, and the resources that have been used to make progress in addressing the challenge or the pandemic that we have faced, or the epidemic that the country has faced, is usually repurposed to other areas. So the staffings that you've had, the capacity that has been built in terms of public health surveillance at the national, state, and LGA level are basically turned into other things. You also see that the funding that the government has provided, political will that you see at the time, we're responding to such crises. Once the crisis is over, those political wins tend to win. You really cannot sustain the gains if you have winning political will, because you're going to need just funding, and that basically has to come to from our leaders, both at national and the subnational level, for public health activities, including public health surveillance. The other thing that usually sets in is complacency. Oh, we have dealt with this issue. This is no longer a challenge for the country. So people go back to their routine way of doing things. Again, we really need to create this culture where once we build up structures, where we put infrastructure in place to deal with a particular health emergency, that we sustain those structures that has been put in place in preparation for the next emergencies that health emergency that it's likely going to happen. The other thing I think that it's an issue also has to do with erosion of infrastructures that have been put in place. Yeah, so again, these measures usually put when you have an outbreak of the disease, you have mobilization of more workforce, you do trainings and building of capacity, you provide resources and all the essential tools for conducting surveillance, for tracking cases and all of those things. But once that crisis is over, we don't seem to maintain all of those things. I think those things that push into doing some other things. I had worked in the polio program. I know when we achieve eradication of the wild polio program. Sorry, I had to bring this example. When we achieve eradication of the wild polio virus in the country, I mean, complacency sets in. The commitment that we see from governors and political leaders across the country wane because people thought that, okay, we do not have polio again, so why do we need to make more investment into public health surveillance? Now, surveillance is not something that happens only when you have outbreak or health emergency. Surveillance is supposed to be an ongoing process that helps you detect outbreaks early so that you can put in the appropriate response and then minimize the impact that outbreak it may likely have on the general public health. So again, I think these have actually might just be some of the factors that could have been, could erode or just slow down the gains that we have made in improving public health surveillance in the country. Now, talking about the things that we need to do as a country to sustain the gains that we have made in public health surveillance that's occasioned by the COVID-19 pandemic. The number one thing is sustain political will. So you don't have that commitment when you have a crisis and then pull out that commitment once the crisis is over. We need to have that commitment all times, whether we are in a health crisis or not. government had to consider providing funds. So we do not need to basically like rely on partners to fund our surveillance system. We need to have sustainable funding from government for our public health surveillance system routinely, not necessarily when we have health crises or health emergencies. Again, to achieve that, I know we're in a political era. A set of government comes and after some time they're gone. For instance, the people, most of the political leaders that were in position when we were dealing with the COVID-19 pandemic, a lot of them are no longer in position because we have transition to a new government. I think on the part of the health system, we need to continue to engage with political leaders and policy makers just to create awareness about the importance of public health surveillance system in the country. Whether we have a health crisis or not, because that sustained funding and commitment to public health surveillance is going to help the country in the long run, not necessarily when we have health crisis. So on our part, we need to continue to engage them, to enlighten them, because basically for you to make policies or for you as a leader to provide a source of funding for a health activity, somebody needs to talk to you about how important that is. You really need to see what benefits you're likely going to gain from that particular investment that is expected of you to do. So that continuous engagement and advocacy to political leaders and policy makers needs to continue. The other thing that I want to talk about is we also need to continue to engage the general public. The role the communities played during the COVID-19 pandemic was very, very significant. We had religious leaders, we had traditional leaders, we have civil society organizations coming into play, helping to create awareness in the country. So that linkage with this non-health sector in the public health surveillance system, it's critical, and that needs to be sustained beyond the duration of the health crisis that you're dealing with. I mean, that in the long run will improve our overall routine reporting of priority disease through the public health surveillance system. One other thing that I think I personally noticed that appeared to have been an important gain for public health surveillance, it's the collaboration between clinical part of our health system and the public health system. I've seen a lot of involvement. Prior to the pandemic, our surveillance officers at the subnational level usually tend to be intimidated, going to meet doctors and other health service provider, especially at the tertiary institution level, to ask about priority diseases. But the way the pandemic was responded to, I know one of the pillars for dealing with the COVID-19 pandemic was that the treatment pillar, and that involved engage a lot of clinicians from our tertiary facilities. I remember once, sometimes where during the pandemic, when some doctors will call and say, we have seen so, and so, who do we report to? So again, I think that the response to the pandemic actually brought about an improvement in that linkage between the public health system and our clinical, regular clinical system. You see a lot of clinicians were involved in the process, and that has created awareness about the need to report priority diseases to the surveillance system. And I think we need to do more to sustain that gain that has happened. But again, the other thing too that I also want to mention, which was an important gain, is the involvement of the private sector, the private health sector in the entire process. We see our lab capacity, our lab and diagnostic capacity expand really greatly as a result of the response activity to the COVID-19 pandemic. The public laboratories increased in number and their spread, but we also had private laboratories that had the capacity to do genetic sequencing being involved. And I think that it's one of the things that improve testing in the country. So engaging the private sector in the process of public health surveillance, I think it's very, very critical if we will want to continue to sustain and improve the performance of the public health surveillance system in Nigeria generally. Maybe I'll just stop here for other panelists to maybe share their thoughts too. Thank you.
Thank you very much. Thank you, Dr. Samuel. That was spot on. And of course, you mentioned quite some very fundamental points. Starting from the challenges, which is there's no plan in terms of sustaining the gains, the winning political will, especially as it relates to funding. There's also the part of complacency that you mentioned. Nigerians are used to moving on. When things happen, we're all agitated and we want to do something about it. But once the situation is calmer, we tend to move on, and it's business as usual. Like we just move back to our business. And of course, in terms of how we can then mitigate this, you mentioned things around sustained political will, in terms of government also identifying funding towards addressing some of these challenges. And of course, having continuous engagement, given that we have change of governments at both the national and subnational level, so that we can get their commitments. I also like the point of, having linkages with the non-health sector, right? For sustainability and the part of collaboration between clinical and public health workers and involvement of private sector. Maybe a quick question to Dr. Oyelado now would be in terms of policies and regulation. So you've mentioned quite a lot of things in terms of how we sustain things, but what I would like to ask Dr. Oyelado is, from the government side, in terms of sustaining these gains, have we had any kind of policy change or a change in regulations in the country as a result of the lessons we've learned? Because Dr. Samuel has mentioned a lot of things which still revolve around the leadership part in terms of governments being committed and heavily involved in this, and also looking at all of the partnerships we've enjoyed. Has there been any kind of regulations or policy to ensure that we don't lose all of these very great things we've had over the time? Yeah, Dr. Oyelado, over to you. And sorry, before you go, Dr. Oyelado, just to mention, please, our attendees, please, I will encourage you to drop your questions using the chat box, please, so that we can attend to the questions once we go to some of the discussion. So thank you very much. Dr. Oyelado, over to you. You're mute if you're speaking.
apologies. Thank you very much for that explicit explanation on the challenges following COVID-19. And one of the major key issues that Dr. Abbott talked about is about political will, which is actually a major challenge. And this has led to a lot of activities, a lot of effort on surveillance activities during COVID-19. Going back to status quo now. But in terms of the public health policies and regulations in Nigeria that we're leveraging on as a result of lessons learned, one of it is currently ongoing. There is an ongoing amendment on National Health Act, which is going to be National Health Act 2023, as well as amendment is ongoing on NCDC Act Bill. A lot of these amendments and acts are actually based on some of the lessons learned on the need to strengthen NCDC Act on its role of detecting and responding to disease outbreaks. And this also came out of a lot of challenges we faced with some states as regards publishing COVID-19 data, and a lot of challenges we faced with a lot of state governors not even ready to own up to COVID-19 within their state and refusing their citizens access to testing as well as the necessary and adequate care. Currently also there is an ongoing establishment. There's been a lot of more review on the need to establish the public health emergency bill. This is also born out of COVID-19, lessons learned with COVID-19. And you recall that even at the global level, generally, as a result of the impacts of COVID-19 and a lot of inequalities and some border closure around COVID-19 and stigmatization, discrimination. At the global level, there is also ongoing pandemic treaty that is being negotiated at the WHO level, which is very similar to what we're doing as regards Public Health Emergency Bill of 2023. The need is to ensure that it states clearly the power, the roles given to national to enforce public health emergency, aside the power given to the states, because the current constitution we're using for public health emergency is actually the constitution of 1990 something, which has the legislative, it has the residual list as well as the executive order. And that means the state government also has the right to legalize on their public health emergencies as well as the health security, which gave, I wouldn't want to mention a state, a particular state, the right to insist that the state should not be tested, and they refused at a particular point, they refused vaccine, but I think towards the end, that was resolved when a lot of grants was actually attached to that. So is some of these policies, the regulations, they are meant to actually empower the public health EOCs at the national to lead the coordination for public health emergencies within the country, using the National One Health Initiative to coordinate this response. And also, it includes the need to ensure there is emergency preparedness fund that will be easily available and accessible anytime there is an emergency. And not just at the national, there should be emergency preparedness fund available at also at the state level. This would be able to help with the challenge of insufficient funding allocation to surveillance and response at the state level when there is any emergency. And currently, we've also been able to streamline infection prevention control at the state level as well as the health facilities level with with the strategy in place at the state level as well as the national to ensure that our healthcare workers are protected and during any public health emergencies. And there are a lot of public health laws that have been also reviewed and launched at the state level. This is part of the health security, subnational health security assessment that is ongoing. The need for states to have their own public health laws to enhance detecting and responding to disease outbreaks at the state level. And within this public health law also is the need for institutionalizing the emergency preparedness fund. We have successfully launched this in Kano. I would say Kano for now, but we started with Enugu, Kaduna, Jigawa, Kano, but Kano has launched this with the establishment of the CARE fund. They call it Kano Emergency Trust Fund, which is now being legalized in Kano State. So these are some of the policies, the regulations, and some of the review that has been put in place as a result of the lessons learned from COVID-19 pandemic. And a lot of this is to ensure that the state, the government takes ownership as much as possible, and also to breed political will. Thank you.
Thank you very much, Dr. Iladon. That was really, really insightful. A lot of things to take away from there. And it's really good to know what the current effort by government has been. I love the part of the amendment of the National Health Act to reflect the current realities, and also the NCDC Act bill. I mean, speaking to one of the points Dr. Samuel also mentioned in terms of funding commitment, I love that part of the emergency preparedness fund that you mentioned, which is part of the plan to ensure that we are more proactive than reactive, instead of responding. I mean, borrow from the word of Mr. Sunday. And the review of the public health laws at the subnational level, because of course, if you look at it, whatever laws and regulations we make at the national, if we don't cascade to the states at the subnational level, it becomes really tricky. So I'm really excited to hear that, and I know that people that are on the call, this is a lot of learning for all of us to, in terms of what government is doing. So, Dr. Adijoke, very quickly, I would like to ask you. So, while there has been a lot of improvements based on the feedback and response we've gotten in the disease surveillance and response capability, are there any particular areas where there has been very significant improvements within public health system? Are there like particular area that we can say, okay, this is what has been most outstanding for us as a country, given all of the learning we've had from the COVID-19 response? Are there specific areas that you want to touch on? Yeah.
Okay, thank you very much. And I'm glad this conversation is leading to this, and then it's also exposing the good things that the government of Nigeria is also doing. So in terms of the particular areas where there has been a lot of real improvement, so one of it is what we had mentioned before, the use of data for action, and then also the institutionalization of the image platform, that's immunization, electronic management of immunization data. Then also our community structures, we have strengthened our community structures. So the pandemic was an opportunity. We already had the Northern Traditional Leaders Council addressing polio, and then we had shifted them to other immunization and public primary health care issues. But this gave us the opportunity to now involve the Southern traditional leaders to be involved in immunization and other public primary health care matters. And we have used that platform to be able to reach people at their communities and that level. So the representatives meet, the council, they meet, and then they discuss, we present our issues to them, and then they use that, they cascade that in their states through their community structures, traditional structures. So those are one of the places that has really helped us to improve. And then part of the community structures are also, there's this program we run in the agency, which is the CHIPS program. That's the Community Health Influencers Promoter Services. So we have, like, we name them CHIPS. So they are CHIPS agents, and then they are community level people who link the people in the community to the health facilities. So we also use them, and then it's also one of the areas that has been discussed to also use them as surveillance when they see they can report, and then also help to build the community surveillance across the country. So those are one of those key areas. And like I also said, coaching capacity really improved, and networks also for distribution to be able to get both vaccines and other health commodities to the health facility, to the community, as close as possible to the people in the communities. Then, okay, I think our partnerships also really improved. As in, we worked across partners that we had never worked with before, organized private sector. We used that, was really an opportunity for us to work across different partners and bring all our experience system, delivery systems, and then reporting, especially for communication and for data reporting. Thank you.
Thank you very much, Dr. Adejoke. Interestingly, you actually touched on what was going to be my next question, which was going to speak to the strengthening community structure and how we've involved the community structure, the traditional and religious leaders in all of these, and how that has been, and how we've improved on that. But yes, I think that's one of the fundamental points you mentioned, and also talking about the ME, which is data for action and leveraging technology, and of course the partnership parts that you mentioned. So that's quite insightful, because of course we all know that during at the height of this COVID-19 pandemic, were a lot of things that happened. Some churches, some mosques, some traditional leaders discourage people from, taking the COVID-19 vaccine. There were a lot of myths and misconceptions around that. So, and I know it was a lot of struggle, right, to align on that. But it's really good to hear what you've said, that now there is a very strong collaboration with the traditional leaders. It's stronger collaboration, because I believe there's always been a strong collaboration. A stronger collaboration, and this will help to further strengthen things going forward. But I mean, now since we're talking about the use of ME and all, I would like to ask Mr. Evans. I mean, talking about technology, how has technology played a role, or what role has technology played in enhancing disease surveillance and response in the country, right? And how can we further leverage this for future public health emergencies? Mr. Evans, I'd like to get your perspective about it.
All right, thank you, Akolade, once again. Yeah. So I think in this response, technology is actually at the center of everything that was being implemented, or the interventions. So one of the key areas, I think it has been spoken, there was a lot of adoption of mobile application, SMS alerts, which really was part of it. And you see there's a lot of integration of these systems. Like, for example, you see like the NPCD was doing around vaccine. You find somebody will get the alerts for either their doses, so which was very one of the key areas, just to alert the public, just to be able to follow up on these dosages. And also there's also around areas to do with adoption of some bits of modeling aspect. I know there's a lot of data analytics and predictive modeling that was being done. And here it was helping us also when case out or predict or project some of the COVID-19 cases. And I know there's some models that were being played around. For example, the University of Pennsylvania had a KIME model that was just trying to project some of the COVID-19 cases. And also to mention, WHO also had a WHO tool to just project the required resources for supplies for COVID-19 essentials. So these were some of those areas that they really looked at. But also there was also aspect of digital contact tracing. Initially traditional methods we were doing using either snowballing, where you're using some peers to trace some of these cases, but there's a lot of use of technology to do digital contact tracing, and this one was just from the point of picking up details, or at the registration point, you were able to have this and be able to use to trace some of these cases from the point of entry. And also, I know people, this platform that we are using, like for example, remote training and capacity building, really was phenomenal use across because of the emergence. So basically, this was used a lot, and so basically it played a huge role in terms of facilitating and capacity building within the healthcare and the public health officials in Nigeria. So I know there's still areas to grow, like early detection and monitoring. So early detection here, we are looking at different various information sources. So for example, looking at the geographical patterns, we are looking at data from the public health hospitals and trying to use this to preempt future outcomes or threats that will be coming up. So right now, I think that was just one of the areas that we are really trying to strengthen and looking at. I think it's an area that at that point, there's a lot of influx of data and some, I think the epidemiologists, some of the technocrats in that area really came in to try and come up with models to be able to preempt some of these outbreaks and projection of cases. So I think also just to leverage a lot of efforts towards also strengthening of the infrastructure itself. So I know we are still not there, but there are a lot of resources at play. For example, the EOCs who have revamped to be able to provide data visualization and to provide areas for discourse for the different stakeholders to be able to discuss their data and also come up with interventions to actually mitigate and also just accelerate towards controlling the epidemic. A lot of efforts towards collaboration and partnership. So I know there's a lot of efforts towards having a lot of localized solutions. So different partners were coming up with different solutions. So there were mobile applications that were trying to align to then integrate with the national systems. So there's a lot of collaboration with partners between in terms of use of technology or just localizing different innovations by the different stakeholders, and also which presents a government opportunity to look at how to also improve their own system to integrate with these systems that are at play. But I know also the major challenge, which was also a benefit, is to give the government to produce some of the governance documents. For example, regulations around data security, data privacy. So this was very key to this because there's a lot of data systems out there trying to collect personal information, PII data across from the different general population. So there was a need to have those regulations in place. So yeah, so I think that is some of the role that really technology has played. But I know to further as we move towards even in future, I think there's still some areas that we need to just tighten up. I still, as mentioned by the different panelists, there still need to be some bit of fiscal allocation for information technology infrastructure. It's not very deliberate, so I think it's more or less responsive than really preemptive in nature. So there needs to be a sustainable fiscal allocation for this information technology infrastructure. And then also just look at it in terms of data integration, interoperability. So I know NITA in its efforts, the Nigeria Information Technology Development Agency has put some efforts towards having a Nigeria enterprise architecture document. And this one also dictates how, for example, partners or other, just generally Nigeria's systems, how they align to the national architecture. So this one also helps them to really interoperate across. I know some systems really have not really, I think we need to really institutionalize this document and also house it so that it really guides in terms of development of the different systems just as in response to these emergencies moving forward. And so I'm a sucker for research and development. I think generally, if you look at it, we need to invest more in research and development. And I know right now with the Africa CDC digital transformation agenda, I think it came a bit late, and I think Nigeria was already ahead of the curve. I know as much as we are talking about localizing innovations, Nigeria was already ahead of the curve in terms of coming up with innovations themselves. So I think Africa CDC is late to the party, but again, they're prescribing a document that we can adopt in terms of localizing innovations for our own to come up with solutions for emerging threats within our borders, and also globalizing the same responses, integrating with an international systems. So that's, I think, the whole my viewpoint on this. There's a lot of movement on this area. Sure. Thank you.
Yeah, a lot of movement, right? So thanks so much, Mr. Evans. And I mean, I tend to agree with lots of things you said. You know, as a person, I receive SMS alert at some point as a reminder for me to go for my booster dose. I was like, oh, what? This is really nice. You know, having some sort of prompts. So that's really good. You mentioned things around the use of model for COVID-19 cases projection and also for contact tracing and all. Like that's really good. And mentioning the areas that we need to really further expand on or explore the geographical pattern and looking at the early detection and monitoring and having regulation on data security and privacy and allocation of funds for information and technology. So thank you very much, Mr. Evans. That's really a good one. So we have people who have questions, and I mean the interest is for us to have people glean insight as much as possible and also lend their voices to this. So okay, we have Abdul Kabir Bello, who is saying congratulations to Sydani for the 5 years anniversary. Thank you very much, Abdul Kabir Bello. And there's a question from Iriagose Uweni. Forgive me if I'm not pronouncing that correctly. So this person is saying, big thanks to the organizers. The question is, why has the sensitization awareness dropped? Because banks and churches and other gatherings no longer practice precautions and measures like use of face masks, hand wash and all. So I would like Dr. Adejoke to help answer that. So is there a reason? I know there was this communication at some point by the Federal Ministry of Health that we are no longer in the emergency mode. So the hand wash and everything had to stop and all. So this person is asking, so why has that stopped? It's like there's no implication again and all of that. So do you want to quickly respond to that, Dr. Adejoke, before we take other questions? Hi, Dr. Adejoke, can you hear me? Okay, I guess Dr. Adejoke has some network issues. So, Dr. Ilado, I would like you to take that while we wait for Dr. Adejoke. So, we're back on.
Okay.
Yeah, so why are we no longer washing our hands? It's like our hands are now very clean and now things are good. So what's going on?
So that's actually a very interesting question, because the pollster should know that beyond COVID-19, hand washing is basic hygiene, which should continue, whether you have a group of people reminding you, or there is an outbreak going on, or there is a pandemic or not. We just celebrated the hand washing hygiene day, and the emphasis is always on the washing of hands before and after you do this, before and after you use the toilet, before you touch any food, after you touch any food. For universal precaution, hand washing is the basic infection prevention control. So it's not just to prevent COVID-19, to prevent other priority diseases like even as cholera and every other form of infectious disease. Hand washing, it's basic. And of course, practicing of cough etiquette and other things, it's basic universal precaution. So ideally, the campaign is for individuals to take responsibility. Take responsibility for your health, take responsibility for the health of people around you. And you don't actually need to wait for jingles, sensitization, or anybody to remind you. But although the campaign, in terms of the jingles and the sensitization, has dropped, but it still continues in a lot of community as well as different level. But of course, not as heightened as during pandemic outbreak, but it's basic universal health precautions that every individual should take to prevent not just COVID-19, but against so many other priority notifiable diseases. Thank you.
Thank you very much, Dr. Ilado. So the next question is to Mr. Sunday. So Mubarak is asking that, looking at the stigma around COVID-19 vaccine, he had made mention that Sydani adopted the use of social media platforms to reduce misinformation about vaccine. That he would like to know what Sydani and his partners did to reduce the stigmatization and increase uptake of vaccine in rural communities because of those that are not on social media.
All right. Thank you very much for that. I think those are two different questions. So one looking at stigmatization, and the one looking at increased uptake of COVID-19 vaccines in rural areas. So for the first one, I mean, the quickest way to address that would be social education or public education. And one of the things that we did in that regard is working with NPCDA to come up with messages that will go out to people, sort of educating people on what to expect, what the COVID-19 is about, and even the COVID-19 vaccine, what to expect, what basically things to know. We also supported a lot of the states. At some point, we trained about 25 states to also use their social media platform to disseminate information on COVID-19 vaccine and sort of re-educate people or reorientate people on what to know and basically how to manage things and how to live with or live around people with the COVID-19. In terms of improving uptake of the vaccines in rural areas, so when I talked about the study that we did, that sort of gave insight into approaches to improving the COVID-19 vaccine, it was multifaceted. So there is the part that looked at the major source of information for people, which social media was ranked highest. And that's why a lot of information went out on social media. But the information that we got went beyond social media. So there's the traditional media, those listening to radios. There is also just generally asking people about who influenced them. And a lot of them mentioned their community heads, the traditional leaders. So in terms of improving uptake, we also had engagements with the traditional leaders at all the levels, at the states, the LGA, and in the communities. So those sort of helped propagate the information regarding COVID-19 vaccines. We also made sure to provide vaccination teams that were available not just in the urban areas, not just at the malls, as we may have seen them, but those that even went to the remote areas, the local churches, the local mosque, the gatherings, the town hall meetings, setting up vaccination sites at the heads of the communities, locations or designated locations, or people having mobile teams just moving around the different communities. And how we sort of prioritized where they should go to was just based on a mix of the proportion of unvaccinated people in the locations, and then proportion of eligible population that were even available to be vaccinated. So that sort of informed where people go to part time. So those are some of the initiatives that were rolled out in terms of addressing the two concerns that were raised. Thank you.
Thank you very much, Mr. Sunday. That was quite insightful. And speaking to the wonderful work that Sydani did at the subnational level and the hyperlocal level, trying to address stigmatization and drive uptake. The next question, I think this will have to go to Dr. Adejoke. So there's a question from Oluchi Basi, who is asking that how is the Nigerian health system in specifics thinking through integrating these COVID-19-led improvements through the 3 tiers of primary, secondary, and tertiary levels of care? Or is it focused for sustaining these improvements only within the primary care system of care? Dr. Adejoke.
Okay, thank you very much for that. So while our focus is the primary healthcare system, we are a National Primary Healthcare Development Agency, we collaborate with other, both the secondary and tertiary level of care. At least with the vaccinations, we had to work through all the levels to get them involved. So it's not just that the gains, our vaccination centers are across all levels. So whatever improvements we are making, the integration moves along that system, especially particularly for primary healthcare. And there are also primary healthcare centers that they also have referral levels to both the secondary and then to also tertiary healthcare systems, depending on the proximity. And those levels were, those are those communications and linkages which we're improving upon. So one of the major challenges generally in improving some of this in integration and in improving some of the systems is that there's actually healthcare, health workers, the workforce is actually limited. So the number of health workers to the population is really low. And that is one of why the linkage is using the CHIPS system, like we explained earlier, is coming in to be able to get these people, reach them in their houses, find out what the issues are, and then reach them also in their, link them to their to the facilities to be able to address some of those. So those are those things that we're expanding to, and we're actually even using COVID-19 funding to expand some of these structures already on ground. And I think part of what we're also using the funds for that we've received is also to be able to, and I think we have another branch called the NEMCHIC, which is addressing childhood and maternal deficiencies and issues. And we're also using that platform that we already have through COVID-19 to be able to recruit some health workers, pay for them at the up to certain level, and then for the state to take over. And that's part of the sustainability plan, to be able to make sure that there are health workers at the primary healthcare level, which can quickly address problems, diseases, issues, and refer as appropriate as it is. But I also want to go back because I had network issues initially. So one of the, I think the problems we're having in sustaining sustaining the hand washing and all those is that there's low risk perception generally across the country. People don't feel there's a need to sustain these measures that we have been put in place, basic hygiene. In fact, nowadays when I use hand sanitizers, people still look at me like I'm weird. So, but it's something we need to put in place to continue to put in people's consciousness. I think we on this platform and we as health workers, if we keep doing it, I think it will keep ringing in their consciousness that, okay, this while the pandemic is over, there's still transmission across in the communities and in other places, and we still need basic, like Dr. Oliladu said, basic rules of infection prevention and control still needs to be put in place and still needs to be practiced and maintained so that we know that we can actually prevent the next pandemic. Thank you.
Thank you very much. Thank you very much, Dr. Adejoke. Yeah, moving on very quickly, a lot of questions coming in. So we'll just try to, touch on the ones that we can and maybe share the rest of the questions with our panelists, and we'll provide the response via our social media platform. But there's one from Mr. Evans. Someone said the PhD student requires data on high-risk individuals or vulnerable individuals to COVID-19 who received the COVID-19 vaccination. It turned out that this data was not collected. How can this be addressed going forward as we plan for future outbreaks? So this is actually speaking to positive of data and some areas on COVID-19. Maybe, okay, I will just leave you to speak to that so that I don't over analyze the question. Thank you.
Yeah. So I think there's only one part to that question. I know the first, in any data collection system, there's always a maturity model. So the first phase, we look at the immediate requirements. So you might find some of these variables that the student needs were not immediate in terms of the first response initiative. So I know most of the systems were guided either by the first set of systems, both either vaccination or surveillance, were guided by the WHO requirements. So basically, they were really responding to the case forms from WHO. So most of them, maybe you might find some of those variables that you're requesting were not part of that, some of those requirements. But part and parcel, and as I mentioned, and just to buttress some of the points that he's raising, I think there's always a room for expanding this to provide more insights to even the decision makers or even students at large. So I think those initial requirements, there's always opportunity for the government who defines most of these data collection tools that can, if it's necessary for the government sees fit, then they are able to provide some of these variables that are there. And if those variables are there and they were not collected, also remember there's also an aspect of patient confidentiality or patient agreement. So the patient might also, the client might refuse to give some of these details. So maybe you might find there's always piecemeal in terms of the data that is collected. But just generally, I think there's an opportunity for more requirements, even if the government sees fit, NPHCDA or NCDC sees it fit to collect some of these variables, then it will be availed in most of these reporting systems. But for now, I think maybe he should just look for focus studies, maybe pick a sample of a population and get some of those and have a specific study to track some of those indicators that he's looking at. So maybe that is the best answer I can give to that. But there's always room to expand either the indicator base, the data element, the variables that are required from our source document, source tools, so that it aligns to some of these requests, the multitude of data requests that are coming in, both from academia and also just generally the health sector. Back to you.
Thank you very much, everyone. So the point is to our dear person. So okay, anonymous. So the response is for now, if you can't find that, it's because the variable of interest to you is not something the country is currently tracking. And just look forward to how you can collect more data. Mr. Evans even went ahead to like tutor us on some, data management system, right? So thank you very much. So that's really helpful. There's a question, and maybe we'll pick like 2 more questions and then we just wrap things up. And this I will pose this question to Dr. Samuel. So Sunday Otto is asking that how can individuals contribute to public health disease surveillance and response efforts in Nigeria? What can we do as individuals? Or should we just sit back and relax and the country got us? What can we do as individuals?
Okay, yeah. So thank you for that question. I think it's a very, very important question. In my contribution, I actually mentioned the role that the community plays. So when you have diseases or health crises, they usually start from the community. One of the things that you can do as an individual is to know that once you have certain diseases, especially diseases happening in epidemic proportion, the best thing to do, the most important thing to do is to report to the health system. So, but there's a link between the community and the health system. Usually at the lower level, we have disease surveillance and notification officers. If you go to the health department at the LGA, the DSA numbers are usually displayed. Sometimes when you go to the health facility, you see posters of diseases that need to be reported, diseases that have outbreak potentials posted in the facility with numbers of surveillance officers in those LGAs. So I think it's all you need to do basically is find those numbers, find the right people, and communicate to them that, hey, we're seeing so and so happening within our communities. Please, can you come and check? Are these some of the diseases that you're tracking, or are these something that we should be worried about, or these are just normal occurrences? So again, if you're not really sure, just find your way to the LG Health Department, ask for the disease surveillance and notification officer. You will get his contact, and he's going to direct you as to what to do. I think the role of the community in the overall public health surveillance system in Nigeria is critical. So yeah, basically, I think that it's the appropriate thing to do. Thank you.
Thank you very much, Dr. Samuel. So yes, the country is, doing what it can. Every stakeholders will, all hands on deck to ensure that things work well, but as individuals, we also have roles to play. Let's speak up, let's communicate to the right authorities, and so that things can be done in the most appropriate ways. If we don't, we'll all become victim of whatever the result is. So, last question I will take from this session, because, questions keep coming in. And this will go to Dr. Adejoke and Dr. Ilado. So there's a question from Jibrin Idris, who is asking what the government is doing to harmonize surveillance mandates of NCDC and NPHCDA and even NAFDAC in the light of outbreak detection and response vaccination, since surveillance and response are hosted in the separate government agencies. These affect speed of both OBR detection and response vaccination, especially for diseases with minimum partner support. So what's the collaboration like across all the agencies within the Federal Ministry of Health, NCDC, NPCD, NAFDAC in this case? Yeah, Dr. Oyelade, you can go first, and then we have Dr. Tijoke.
Okay. That's quite interesting to actually ask. I will start saying, first of all, I don't think there should be an overlap in the mandate. There is really no overlap at all. But you recall before the establishment of NCDC, there's been different surveillance activities at different agencies and different organizations. And when NCDC was established, the NCDC Act stipulated that NCDC has the mandate to coordinate all surveillance activities in the country. Yes, it is a mandate, but I would say Rome is not built in a day. We coordinate all the surveillance activities, provide quality data for response activities across different agencies, in which reactive immunization, vaccination is one of them. We provide data necessary for response for MPACD as much as possible. So in terms of the mandate, it's written plain and on paper, as well as assented to by Mr. President. But in terms of migrating all those surveillance that have been in different agencies and organizations for so long actually takes time and requires a lot of strategies. For the new surveillance that we're establishing, yes, we're starting off at NCDC, providing support and providing data for the necessary stakeholders. For things like polio, we've been on the polio transition for a while now, and it's also an ongoing discussion. For things like adverse effect following immunization, AFI, which is also part of NAFDAC mandates, we've also been in communication, and we need to put system and strategies in place to ensure that when this is fully transited into NCDC, we'll be able to continue running the system appropriately. At the same time, we don't want a situation whereby we would migrate from paper back to paper, because currently at NCDC we're running on a digital platform. We want a situation whereby we should be able to finalize our interoperability system in such a way that we'll be able to draw up the data directly into the system, which the discussion is actually ongoing. And part of the amendment of the NCDC Act is also to ensure that we streamline and harmonize all the surveillance data under one house, which eventually would also be transited into NCDC. So when it comes to collaboration currently, we're collaborating closely with MPACD, collaborating closely with NAFDAC. We make data available on them. But when it comes to surveillance activities in terms of the mandate, it is strictly within the purview of NCDC. Thank you, and over.
Thank you very much, Dr. Ilad. Dr. Adesoke, be very quickly. I would like you to lead the rest of it.
Okay, thank you very much, Dr. Iladun. I think she's basically said it, and we have a good collaborative system with which we work to exchange data, exchange information. And I think on even most of the structures, especially even when outbreaks occurs and everything, the pillars are there and the structure is there for everybody to follow and to play their role. So there's no competition or fight about it. We are just we're moving as one country, and it's the same data we're using across board. Thank you.
Thank you very much. So to answer your question in a very funny way, so the end at the beginning of MPACDA, NCDC and NAFDAC means that there's a nexus. So there's a connection across board. So yes, yeah, thank you very much. So it's been a very good one, wonderful session. And honestly, I can't but appreciate our panelists and wonderful audience for staying tuned and for the wonderful engagement on the call. However, we have to just draw the curtain at this point. So I want to sincerely appreciate everyone for the very wonderful insights. I can say proudly that I'm well informed, and I feel like I've taken a 10 years course on public health disease surveillance and response in the country. Yeah, fully armed. I hope others on the call can say the same. So thank you very much. To wrap this up, I will hand over to my colleague, Dr. Evelyn Oria, who will be giving a vote of thanks as we wrap things up on the call.
Thank you, Akolade. Right, so thank you once again. On behalf of my managing partner, Mr. Sydney Sampson, and the entire Sydani team, I'd like to express a deep appreciation to all our seasoned public health personalities who took out time from their very busy schedules to be our panelists today and provide such great insight into the topic of conversation today. This is not forgetting all our attendees and all the participants who had very interesting questions to ask on this session. We also want to appreciate you and thanks so much for being part of this. Also, as Mr. Sydney had spoken earlier, and also Akolade, this webinar heralds the activities leading up to our celebration as an organization at 5 years. So once again, I just want to say thank you everyone for coming on and visit our website, www.sydani.org, to get more information about the webinar and even our upcoming activities. Thank you.
All right. Thank you very much, everyone. Thank you, thank you, thank you, thank you. It's been a very great one. Thank you for staying tuned with me. And bye for now. Till we meet again.